Hello guys, this is Avinash and you are watching Dr. Dental. Smile changes the mood. So guys, in today's video we are going to discuss the second part of the mandible, that is the muscles attachment which are related with the bony surfaces of the mandible. So, and in the next video, that is in the third part, we will be discussing the nerve supply and the blood supply in the mandible region. So guys, watch this video till last and don't forget to like, share and subscribe the channel, and also click on the bell icon to get the notifications fast. So first of all let's revise various bony surfaces that are present in the outer surface as well as in the inner surface of the mandible. So if you will see the outer surface, then this is the symphysis menti as we discussed earlier, and this one is the mental protuberance, and here is the mental tubercle, and this one is the mental foramen, and this is the oblique line which is running downward and forward towards the mental tubercle, and this is the digastric fossa. This one is the digastric fossa, and this is the ramus of the mandible, and this is the angle of the mandible. This is the coronoid process, and this is the condylar process. And here we cannot see here clearly, it is not demarcated properly, but here there is the presence of the incisive fossa. Similarly, if you will see in the inner surface, then there is the superior genial tubercles and the inferior genial tubercles. These are the four small elevations present superiorly and inferiorly, just posterior to the symphysis menti. Now here is the mylohyoid line which divides the sublingual fossa and the submandibular fossa. This is the mylohyoid, this is the mandibular foramen, this one is a mandibular foramen, and here there is lingula and it gives attachment to the spinomandibular ligament, and here is the mylohyoid groove is present, and again this one is the coronoid process and this one is the condylar process. So if you will see the muscle attachment, then to the coronoid surface in the outer surface, here is the attachment of the temporalis muscle. So here there will be the attachment of the temporalis muscle, and in the oblique line, gives origin to the muscle, that is the buccinator muscle. So the buccinator muscle is originating from this oblique line. So this one is the oblique line, and again from this oblique line there is the origin of two more muscles, and which is present just in the molar region, in the below the molar tooth region, that is the depressor anguli oris and the depressor labii inferioris. So here there is the presence of the depressor labii inferioris and the depressor anguli oris. Now below to the depressor anguli oris, there is the presence of a muscle that is known as the platysma muscle. So here there is the attachment of the platysma muscle, and below to the incisive fossa, there is the presence of two more muscles, and it gives origin to these two muscles. These are the mentalis muscle which will be present here, and just below to it there will be the orbicularis oris. So incisive fossa is giving attachment to more muscles, that is the mentalis and the orbicularis oris. Now similarly, if you will see to the inner surface, in the inner surface the muscles attachment, if you will see in the neck part, this one is the neck part of the condylar process, and here there is a muscle known as the lateral pterygoid muscle is present. And similarly, as we discussed earlier in the outer surface, similarly in the inner surface, in the coronoid process, there is the attachment of the temporalis muscle in the coronoid process. Now just below to the where the just behind the molar teeth, there is a muscle known as the pterygomandibular raphe. So pterygomandibular raphe is present just behind the molar teeth, and behind to the pterygomandibular raphe there is a muscle known as the superior constrictor muscle is present. And in the mylohyoid line, if you will see, then the mylohyoid muscle is present just in the mylohyoid line, and in the submandibular fossa there is the submandibular gland, and above to the in the sublingual fossa, if you will see, then there is the sublingual gland. Now if you will see to the superior genial tubercle and the inferior genial tubercle, if you will see the superior genial tubercle, then the muscle attached is the, here is the genioglossus, and in the inferior genial tubercle the muscle attached is the geniohyoid. So two muscles, that is the genioglossus and the geniohyoid. Genioglossus gives attachment to the superior genial tubercle, and the geniohyoid gives attachment to the inferior genial tubercle. And here you can see the digastric fossa, and in this digastric fossa there is the attachment of the muscle, that is digastric anterior belly is attached in this region. So all these are the muscles that are attached to the mandible, and they have various functions which we will be discussing in the latter part of this video. So guys, I hope you learned something from this video, and don't forget to like, share and subscribe the channel, and also click on the bell icon to get the notifications first.